Hi, everybody. This is Jim Prusak, licensed physical therapist from the Pain PT. And today I have an interview with Dr. David Schechter, MD from Los Angeles. Look forward to bringing this to you guys here today. And I want to give you a little bit of background of Dr. Schechter. He's a physician, family and sports medicine physician for over 30 years now. And he's been practicing in this area of treating orthopedic, structural conditions, as well as TMS, what we now know as neuroplastic conditions. He had the fortunate experience of spending time with Dr. Sarno himself, which you'll learn about in the interview. Dr. Schechter is a top doctor, named the top doctor by Los Angeles Magazine in 2018, 19, 23, and 24. He was named the top doctor by Men's Health Magazine and by US News and World Report. So I look forward to bringing him today to you and his expertise, and I hope you enjoyed today's video. I'm from the Pain PT. Good to see everybody out there today. I'm really happy to have a special guest today, Dr. David Schechter. How you doing, David?
Hi, nice to see you.
Thanks for being here. We were just talking off air, and I was like, we better hit record because we'll keep talking and not record anything. So I'm happy you're here, and yeah, I wanted to just a lot of people know you, right? You're in Los Angeles, and I just wanted to give your intro as that I was when I was first coming to this work years ago. I was coming back from Australia. I had done some manual therapy training, and I was just kind of get starting to think, God, there's more to this pain than what we think. And I had come across Sarno, and I reached out to him. He was still practicing, and he said, "Hey, why don't you go see Dr. Schechter in LA?" And then I'd reached out to you, and you were the first person I saw that introduced me really in person to the work. So I was grateful for that. And here we are now. I don't know how many years that was ago, maybe 10, 15 years ago. So thanks for being here today.
It's been a while, and we've sort of stayed in touch peripherally over the years. It's
Yeah,
funny
yeah.
because people think of LA and San Diego, California being very close, but of course it's over a 2 hour drive, and it's just the nature of the beast here and on the West Coast. Things are a little bit farther apart.
Yeah, absolutely. Well, maybe share a little bit about your work and how you came to the work you do now with these neuroplastic symptoms.
I initially was a walked into Dr. Sarno's office, and he was not yet known as the guru of mind body medicine, but I ended up becoming a patient of his with I was having knee pain that wasn't getting better. And I went to his seminars and his teaching sessions, and boy, it made a lot of sense to me. It felt like a weight was lifting off of me because I felt like I was pressuring myself to get better from knee pain, and the doctors I had seen were not providing helpful information. Fortunately, I didn't have anything structurally damaged, but the usual physical therapy and strengthening hadn't worked. So being exposed to these concepts that the emotions could be a big factor was a shock to me, and yet it
You were
sort of
in
made sense.
medical school at the time? Was that the
I was
story
in
after
medical
medical
school. I was
school?
under a lot of pressure and stress. First year medical school is not a fun experience. It's a lot of a book study. It doesn't involve the clinical work that I, of course, enjoyed much more in my third and fourth year of school. But yeah, I was in medical school, and then after that, I spent time in Sarno's office. After I got better from knee pain, I spent time in his office the following summer doing a follow-up study. So I got to see patients with him and then also phone 175 of his former patients and began hearing the same story that I had, which is you get exposed to these concepts and you learn about it and you start thinking differently, and the pain can go away. So that
Hmm.
was a powerful thing for me to experience early on in my career.
Yeah, what was it like? Maybe share with the audience because you did have the fortune of working with Dr. Sarno in person. What was he like? What was he like with patients? I mean, he was doing such groundbreaking work at the time.
Well, he was very confident. I would say he was forceful or assertive with patients, and that they responded well to that. I was telling the story recently of a woman that came in a wheelchair. Now, this is going to, he wasn't a faith healer, right? He wasn't taking people out of wheelchairs and healing them, but she was pushed down the long hallway at the Rusk Institute to his office, and she was in a wheelchair. And then she had to get out of the wheelchair because his office wasn't ADA compliant. She had to walk a few steps to get into the room. This was the old days when buildings weren't built quite like they are now. But she sat down. I was able to sit in the office for the visit, and he talked to her, and he found out what was going on in her life, and talked to her husband, and examined her, and he told her she had what he called TMS at the time. We're using the term neuroplastic now; it's the same thing. And he specifically walked her out and saw the wheelchair, and he said, I'll tell you what, you're not gonna ride back in that wheelchair to your car. I want your husband to push the wheelchair, and I want you to walk beside him, and I'm going to even watch to make sure you do it." So he gets outside, and she's a little tentative. It wasn't really that she couldn't walk; it was that she was afraid to walk, that it was going to flare her up.
Mm.
And she walked all the way down the long hallway. We saw her at the very end. We waved and got off into her car. And my understanding from her follow-up was that she had done very well with that. So it shows you that he wasn't afraid to push somebody. He wasn't afraid to be assertive and say, "You have a benign condition. I understand it's causing you pain, but you have to push yourself a little bit to get better."
Yeah, I know with Sarno, well, a lot of his books where he talked a lot about heavy about rage. Anger was his. People said take that from the book. How much did you see? Was he in person? Was it any emotion? Like you mentioned, fear as being another emotion that could contribute to this.
When you say emotions that he talked about, or
Yeah, well, he has always mentioned rage, as his
yeah.
big thing about the books. But did he address other emotions as well, or was that his main thing
I
he?
would say that he was trying to develop a psychological theory based on his understanding of sort of a physical symptom that he believed to be psychologically based. And when he met with a psychiatrist in New York, he was very influenced by their concept of suppressed anger and rage. And that became sort of his focus.
Hmm.
Um, Dr. Sarno was not the most flexible person. And so if I would bring up other emotions and things, it's interesting. Arlene Feinblatt, who spoke by a video at our Boulder conference last year, I believe you heard her.
Yeah,
Um, she mentioned that other emotions are relevant, and she was the original therapist that helped develop these concepts with him. But he definitely thought that anger and rage were the most important. I think they're important, but they're not the only ones. Um, I mentioned his assertiveness, but at the same time, a little bit of lack of flexibility sometimes when it comes to other ideas. You may recall that a few years ago, I wrote a book called The Lessons Dr. Sarno Taught Me, and it talks about my experience being mentored by him, and both the good and the bad of having a very strong independent mentor who was able to practice and come up with these ideas surrounded by 600 doctors who really didn't agree with him at the NYU Rusk complex there on First Avenue in Manhattan. So you have to be a sort of a different type of person to be able to be independent and come up with these ideas and stand strong for them. But at the same time, it doesn't always make you the easiest person to argue with.
yeah, yeah. Well, I heard those stories about him and the frustration levels, obviously, because he was out there on his own. And but you had that great opportunity to work with him and see his work, and it was just probably just amazing. And then you took that, and then what happened? So you finished medical school, you went into just regular practice.
Yeah, I
What
finished
happened?
medical school. I decided to do my residency in family medicine on the West Coast. We stayed in touch. Then I did a certificate of added qualifications in sports medicine so that I had the musculoskeletal skills. And I was seeing some people with TMS, but then we reconnected on a project that someone else came up with on the West Coast that flew me back to New York at their expense to meet again with Dr. Sarno, and we got to sort of catch up and see what he was doing those days. And that led to him saying to me, "Do you have a practice?" And I had just opened a part-time practice, whereas before that I had been teaching and working in other doctors' practices and things. And he said, "I'm actually getting a lot of calls since my last book came out, and I don't really have doctors to refer to. It's you, me. We could fit in a closet the number of doctors who know about TMS at this point. We could do the whole conference in a closet." He said at that point. It was much different years later, obviously in Boulder, Colorado, and even prior to that in Ann Arbor, Michigan. But he started, so I go back, I gave my business card and I go back to California. I think maybe I'll get a call once in a while, but the calls started pouring in because he had published Healing Back Pain, his second book, which was a bestseller. And a lot of people were calling him on that. So he didn't want to see people from out of town. He had enough patients from the New York tri-state area, and he was referring the best he could to doctors. See a number of people with TMS, but to see people in larger numbers, to be able to start doing an educational seminar, which is something that he made a core part of his program, and um, and also to to develop a program, right? To think about this not just as I'm treating one patient to say, but to say to myself, how can I more effectively treat the 20 people I see that month or the 10 people I see that month? And that made me think about, journaling. It made me think about writing my first book, which was the Mind Body Workbook, over 25 years ago, and my subsequent books as well. Because Sarno would say education's the penicillin for this disorder. It's
Mhm.
not quite that simple because, education doesn't fix everybody. There's also a need for introspection and psychology with many people. But given that this is an education's always been a key element to this, his educational lectures, the education he did in the office, and then in my own practice, I started doing lectures and then recorded them and turned them into a video program and an audio program and other things, and then my books. So education and home education has always been a key part of this. Now we have so many resources. It's so
Mhm.
much different. It's so much different than it was when I started with this work because at that point we had a couple of Dr. Sarno books and there was nothing else. There was no internet, there were no videos, there was no workbooks. And gradually, I've written things, other doctors have written things, other therapists have written things, and we've got almost too much material. I have to
Mhm.
sort of hone people on what they should study because maybe you find this as well, Jim, but some people will overstudy, will kind of read too many things and just get their head spinning with too many facts. How do you handle that when that comes up, Jim?
Yeah, absolutely. No, I think that's you're right about more and more as more things emerge, more practices. We have PRT now, we have EAT, we have, lots of different things we could do, mindfulness, breathing, exposure training, you name it. So it is hard, and people sometimes are doing too much. I just had a guy today where I sat and talked to him this morning, and his wife came on, which is really helpful because she said, "Yeah, I know he pushes himself all day. He's like, I got to do this now, and I got to do that, and why am I not getting better?" And I do see that type of personality, right, who just wants to do everything well-meaning, but it's too much stress they're creating when they're doing that.
Yeah, sometimes we have to back people off. I mean, I tell people that, 10 to 15 minutes of journaling and 20, 30 minutes at most of reading and watching videos and podcasts and in this field, right? Stay away from internet searches, stick to the sort of circumscribed or curated material in this field, and you'll do okay. And take breaks. It's not just you're trying to heal from pain. You're not trying to turn pain into your profession.
Yeah.
That treating pain is my profession, it's your profession. It's not the patient recovering. We want to make them able to go back to their own life, to their own avocation and vocations, not become a pain expert. You want to recover
Yeah,
from pain.
identified with that pain. Yeah, no, 100%. And coming back to your practice now, which makes you unique as a physician, and we talked off air about this, is that the power of assessing somebody in person when you can do that, right? And like maybe share a bit about that. You watched Dr. Sarno. I know when I saw you, maybe it's a little different now, but you use some of the same assessment tools that he had done, right? Assessing the body plus your other medical
Right.
skills.
Well, so we could talk about like virtual versus in person. So you can talk to somebody on video. We were having a nice conversation now, and it's pretty similar to talking to somebody in person. You get some visual cues as well as the auditory input. But there's something about being in the room with somebody that does add a certain element to the human interaction, to the relationship, to the ability to trust somebody. And then the key element is just taking a detailed history with somebody. You can do that virtually, you can do that in person. I like to examine someone. I like to see how they move. I like to see what their range of motion is. I like to see if they're restricted by fear or by pain. And
Hmm.
I can deal with both of those, but I want to see what it is. And then I do touch those six tender points that Dr. Sarno first identified, and I find that that's helpful. Many of the TMS patients have two to three or more of those six spots that they're tender in, can help to confirm the diagnosis. And I also touch other parts of their body that are hurting because I really want to understand that. And I can give a better assessment of a hip or a knee by touching and ranging it as you can as a physical therapist in person than we do virtually. Follow-ups are less important to do in person, in my experience, but it's really helpful where possible. It's not always possible. Some people live really far away, or there's no doctors or therapists nearby. But where possible, it's nice to have at least one visit with a physician or with a practitioner in person if you can.
Yeah. Yeah. Tell me, yeah, exactly. Tell me a bit about, with the assessment, being a physician, and we said not everything is TMS, and how, you have that mindset because we can think, okay, everything's TMS, but it isn't, in terms of distinguishing that, or like a mixed case versus a pure TMS or a physical case.
Right. I started to describe the mixed picture in my book in Think Away Your Pain. Before that, there really wasn't this concept in our field. It was a little more black and white. Sarno was a bit of a black and white thinker in terms of he would say it's either TMS, neuroplastic, or it's infection, tumor, fracture. Right. He didn't have a lot of other choices. He felt in general that all discs were irrelevant. And I find that some disc pushing on a nerve, making a leg weak is relevant. And many discs that are bulging a small amount or otherwise, again, I look at imaging too. So that's another thing. I can do that remotely if you send me a disc or access to something. But again, it's nice to look at the imaging with the patient. You can share screen. Again, there's lots of things we can do with tech. I get that. But there's something about, again, being in the same room, pointing and looking at the imaging. So I'm pretty comfortable looking at imaging of spine and knees and hips and shoulders and kind of trying to discuss that beyond the report, which is also helpful, but I look at the images. So some people will come in absolutely convinced they have TMS, but I have to say to them, and it's not that common, but I have to, because remember, these are people self-diagnosing, so they're not going to be 100% right. Even doctors aren't 100% right. Certainly a patient's not going to be 100% right. But sometimes I have to say, you have a structurally based problem. Here's how we can approach it. But my attitude and my approach is very reassuring. So they feel like they're in the right place, even though they didn't get the diagnosis they wanted. Also, don't have any skin in the game. I don't do surgery, so I'm not going to be somebody that's going to be saying to them get surgery unless it was absolutely necessary, which is extremely rare
Yeah.
in my experience. You can also have a mixed picture. So you alluded to that. It gets more complicated because it's great to be able to say to somebody there's nothing structurally wrong. I love to say that. It's 100% neuroplastic. That's a great way to move forward. But I also have to be intellectually honest. There are some people who have a structural element and a mind body TMS neuroplastic element. I still feel we can make great progress with those people. It just becomes a little harder because we can't ignore every symptom and just say it's always TMS. And so
Yeah.
we're talking now about sort of the gray areas of this field. And sometimes people like things when they're black and white. And but you and I are physically trained doctors and physical therapists, and there are physical injuries and there are physical issues. I'll give you another example of one that's kind of interesting. And I have helped some people with this. So about, I don't know, 5 years ago, I went to a foot doctor because my toe was hurting. And I used to do a lot of running. Don't really run long distances anymore, but I do a lot of other activity. And, I didn't want to treat myself. I could have just gotten an x-ray and looked at it, but I said, I'm going to see a foot guy that's a friend of mine, qualified foot doctor. And he gets an x-ray and he comes back and says, you got arthritis in your toe, which is not that uncommon in my age group. It's not that uncommon when you've been a runner. I said, what are the options? What are the treatment options? He said, you know what they are. You can get anti-inflammatories and ice. And he said, we're occasionally putting this rubber thing in this replacement joint, but it's still kind of experimental. And I said, I'm not really looking for surgery on my toe. So the way I approached it when I went home was, I've got arthritis in my toe, and I'm just going to ignore it as much as I can.
Hmm.
And I very rarely notice it. And I play softball and I play pickleball and I walk long distances. And occasionally there's a twinge, and I say, "Oh yeah, there's the arthritis in the toe. I'm going to ignore it." So
Yeah,
it's
and
a
that make
structure.
a good point there too, because the way you just talked about it and handled it is important to me. I'm here listening to you go, it's not a big deal, right? Someone else might say, oh my God, I got arthritis in my toe, right? So maybe speak to that as how you
So
take the
yeah, so the
information.
attitude, right? Having the attitude of things are going to change as we get older. I mean, we get gray hair of the spine. That doesn't mean we have pain in the spine. We get little bits of arthritis in different parts of our body. Doesn't mean we can't be a functional person, even an athletic person. I mean, I play in softball and pitch softball and run the bases, and I feel fine. Occasionally, the toe hurts briefly, and I
Yeah.
just notice it and ignore it. So, paying less attention to your pain. And again, I got it diagnosed first, right? I didn't even diagnose myself.
If
I
you
got it
had gone
diagnosed.
into the mixed case, let's say you were the person who was very highly anxious or
Yeah.
fearful, and you layer that on top of that arthritic pain, your pain would probably be there much more, I imagine.
Right. So so sometimes you have to work with a patient and say, yeah, there's a little bit of arthritis in the hip, but I really don't think you're at a level where you need a replacement. Now, some people are at a level where they need a replacement, and hip replacement surgery can be very effective for people. Some of my patients have gone back to walking 8 miles a day or playing doubles tennis every day or playing pickleball. The one thing they typically don't have you do with a replaced hip is run long distances, but everything else you can pretty much do. But there are also people with mild arthritis. The hip will get a pain, and they start worrying themselves into, do I need surgery? And maybe even a surgeon says, I could fix it. But we talk about it. We get the anxiety down. We get the fear down. And say, okay, you've got a little arthritis in the hip. Maybe 10 years from now, you need a replacement. I don't think anything's going to happen in the meantime. You're going to be fine. And I can't even predict the future. Maybe this hip will be good enough for you for the next 30 years, and you'll outlive it, so to speak.
Yeah,
Getting back to the basics, right? Anxiety, fear, worry about the pain, how your attitude to the pain can be very important.
absolutely. No, that's what I was trying to allude to is that idea of the fear of the symptom taking over, the hypervigilance ensuing, the focus, the all that kind of stuff. I see that in a lot of people, and I think as a physician, you're right, you can reassure them. And have you seen that go a long way for a lot of people, just getting that sort of reassurance and
Well, one of the we were talking about categories of neuroplastic symptoms, and one of the categories is iatrogenic, which means caused by doctors. So I have patients who come in. I'll give you an example. There was a woman who was having back pain. This was before she saw me. She went to a physical medicine rehab doctor, which you would think would be he's a non-surgical specialist. You think they would be kind of reassuring or whatever. And she was actually feeling pretty good that day, but he had the MRI already up on his computer as she walked in. He had not yet examined her. She had talked to his assistant or something. So she walks in feeling pretty good that day, but wanted to know what he said. And he looks over, he looks at MRI, looks at her, hasn't examined her, hasn't talked to her in depth, right? Just the assistant talked to her. And he says to her, I'm shocked you can even walk in today with this back. And that left her really paralyzed in fear for the next few months. Eventually, she found her way to my office. And I said to her, your MRI is really not that worse than most of the people in their 50s. I wouldn't worry about it. It's not that bad. And you generally are pretty good. Just start swimming more often, stay active, and let's just try to work on some things to lower your anxiety about this. And she did great. And it
yeah.
was
She
really
took she believed you, right? She took your message
yeah,
into
she took my message, my authority, and my function was kind of to deprogram her from an incorrect diagnosis and an tremendously overly over the top diagnosis that she shouldn't. Maybe I'm shocked you could walk. It's stupid. I mean, you wonder when you hear these comments. And by the way, they're not that infrequent, unfortunately,
I
among
know.
surgeons, orthopedists, other specialists, sometimes chiropractors, and they're not that infrequent. And people will come in and just they remember every word that doctors say to them 5 years ago, 3 years ago, 10 years ago. People who can't remember what they had for breakfast 2 days ago. It's incredible how that
That
gets
nocebo
in your
effect is real,
the
isn't it?
nocebo. And so I have to exactly. That was the word I should have used. The nocebo. So many of you have heard of placebo, which is a reassuring, a positive statement or an inert pill that causes your body to activate its healing mechanisms. And nocebo is the opposite, where something is said or something occurs that you believe is going to make you worse, or that the effect of it makes you feel worse, and then it continues to cause your symptoms. So that's the nocebo, exactly. So the nocebo or the iatrogenic, we have to become deprogrammers. And if you've had these kinds of recommendations from doctors, get another opinion,
Mhm.
ideally from one of us. But if not, get another opinion in your community, because you may find, as I have, that people see four surgeons and get four different opinions.
Yeah. And maybe that's great information. And I want to touch on your book and your workbooks, right? And especially the workbooks. So you had put those out a long time ago. I remember getting the original one and seeing it, and it was good. And then you've updated it. So maybe share a bit about your evolution, right? And as you've been doing this work for a long time, and is the newer workbook a bit different? Have you added some more stuff to it?
Yeah, so I found journaling to be really helpful as a therapeutic tool, right? Expressive writing. It's really about connecting with your emotions and writing about them on paper instead of letting those emotions just simmer in your head and do, unfortunately, sometimes bad things to you. And so I started with just journaling in a notebook, and some people do really well with that, but people often run out of things to write about. So I came up with the concept of a guided workbook, a guided journal. So you get prompts every day. And the original Mind Body Workbook gives you 30 days worth of prompts and guides you through a process of looking at yourself introspectively. It's the cheapest form of psychotherapy available, right? So a few years ago, I had known a psychologist for a while, and we decided to write a whole new workbook called the Mind Body Workbook. Now, unfortunately, I named it Volume Two, so sometimes people think you have to do the first one first, but this is actually the updated, revised. It's all brand new. They don't overlap other than mention each other. It's called the Mind Body Workbook Volume Two. There's two authors to this one, and I include affirmations every day, which I have found to be helpful. I include a little more psychologically in depth and interesting prompts because I had a co-author. I think it's an improvement on the prior one, although it seems like on Amazon the other one still sells more because it's been known for so long. And maybe the title is confusing, but the Mind Body Workbook Volume 2 is my newest journaling tool. It costs a little bit under $20, and it's gives you a chance to spend over 30 days thinking about what are these emotions that are potentially perpetuating your pain. It can be a tool if you're seeing a therapist or a coach, and it can be a tool if you're not seeing a therapist or a coach. If you're seeing a
Yeah.
therapist, you're seeing them 1 hour a week. What are you doing with the other 167 hours? So this gives you something to do for 10 or 15 minutes every day that's emotionally based. And also, we talk about action being important in recovery, not just thought. And this is actually an action step, which is writing about your feelings, not just thinking about something or thinking about, what book you've read that week.
Yeah. How have you found, because with that workbook over the years and people, carrying it out and following it
Yeah.
and exploring their emotions, writing them down, have you seen what kind of effects have you seen in people?
Oh, tremendous, tremendous effects. I mean, journaling doesn't seem to be for everybody. So I understand there's going to be some people who struggle with it. I've seen a few people on the internet call it the dreaded workbook, but that doesn't mean that they find it to be not useful. It can be challenging to sit down and write about your feelings. But 40 to 50,000 people now have utilized this workbook based on sales in the office and on Amazon over 25 years.
Mm,
And there have been a tremendous number of success stories using this. And it doesn't necessarily have to be your whole program, right? It's a piece of your program.
yeah.
Obviously, reading books, watching podcasts, watching YouTube videos, meeting with Jim, meeting with me. There's different things you do in your program, but journaling or expressive writing, however you decide to do it, can be extremely helpful.
Yeah. Okay. And I agree with you on that with the emotions. How about maybe speak a bit about personality? I know you mentioned that in your Think Away Your Pain book. And how much of that do you look at and think how important that is for some
But
people?
the original Sarno concept, he mentioned a number of personality types, personality characteristics. And so I codified that and said, let's call this the type T personality many years ago, right? Because there's a type A, there's a type B in psychology. Type T is a little different. It's not exactly the same as type A. So type T personality is someone who's very responsible, typically highly self-critical or hard on themselves, often a perfectionist, but a perfectionist who doesn't like being a perfectionist, right? There's some people who like being a perfectionist. They like being an artist that spends that extra hour perfecting their craft. But sometimes this is perfectionism that causes tension, not joy. Um, and there's other elements to the type T, but those are the key ones. Responsible for others, hard on yourself, perfectionist, people pleaser is another one. Goodist can be another one. Sarno brought that concept up. It's hard to change yourself. It's hard to change your loved one, probably impossible. And it's certainly hard to change the world. But I have a lot of people who are trying to change the world. And we can all play our little role, but if you get frustrated at how slowly the world changes, it can make you have pain. It can make you tense. It can give you symptoms. And so I work with people on either staying away from the media or lowering their level of activism a little bit, or just accepting the fact that the work takes a long time to accomplish, and one person's not going to accomplish that. Very few of us are Martin Luther King Jr. or Abraham Lincoln or something of that sort. Most of us are ordinary people just trying to do a little bit toward bettering the world.
Yeah, and those traits you mentioned, they're like you're saying them. I go, yeah, almost all the people I see, I'm sure you're the same. They have those, at least some of those characteristics in them.
What do you do when you have those, right? So that's a question. You're not going to change them. You're not going to get rid of them. You can just dial them down a little bit.
Yeah,
If you
say
become more aware of them,
soften them a little bit.
soften them up. If you become aware you're a 9.5 out of 10 perfectionist, go to an 8.5. You'll still
Yeah,
do a great job at work. You'll do a great job at home. If you're 10 out of 10 self-critical, lower it to 9. I
yeah,
mean, that 10% less can make you feel a lot more relaxed about things. Even if you get upset about some things, but you don't get upset about 10% of them, it'll make a difference. And maybe next year you can make it 20%. So you don't have to become a 2 out of 10. You just have to dial it down, soften it up a little bit.
Yeah, that's what I say. Bring it down enough to get below the threshold. You may not have symptoms anymore. No
Right.
one's going to completely change their personality.
No.
But that like idea of the internal stressors, right? That we're creating that stress ourselves versus external stressors. I think it's an important area to address with people.
Yeah, the external stress comes in, but it's mediated by your personality, your persona, your how you handle things. So we sometimes we can change the external. There's people who need to quit their jobs. There's occasionally a person who needs to change a relationship or something like that. But that's not the core of this work. The core of this work is what can you do to yourself to make you more resilient and less likely to go into a pain flare up from external circumstances.
Yeah, yeah. Here's a good question for you, and it might not have exact answer to this, but what percentage or idea do you think of people getting better through education and understanding, like getting the diagnosis from you of TMS or neuroplastic symptoms versus the people who have to do the work, some emotional work or some deeper work? What's your sense of that?
People ask that a lot. Sarno in one of his books said he referred 15% of his patients to psychotherapy. Other people sometimes quote these statistics as if
Yeah,
they're dogma, as if they're biblical. And 25%. I'm very open to working in a team setting. So I see the patient, I kind of gauge where they're at. I mention to them other resources, which could include coaches and therapists and things like that. And then I just kind of see where they're at that point. I say, hey, we'll follow up in 3 or 4 weeks on a video visit or in person. Let's see how you're doing. If somebody has a lot of childhood trauma, if somebody has a lot of adult trauma, if somebody has been doing this work for a while before they see me and are struggling, I'm more likely to involve a therapist, a coach, other people on the team. If somebody comes in a little bit newer to this, I'd rather get them to read a book or two first, do some journaling, see me back, ask questions, and then we can decide if we need the quote more in-depth work. But I look at it, I'm very comfortable in the collaborative team model. I mean, I've had therapists work in my office. I've had I have close relationship with therapists in LA, and now I'm getting more close relationship with coaches, as that's a burgeoning field in the TMS neuroplastic recovery area. So I don't want people to feel like if they're stigmatized because I'm referring them to a therapist. It's just how big a team do you need, and how can each person contribute to helping you to get better?
yeah, it's a great answer. It's variable, right? Depends on the person
Yeah,
and the situation. And that also applies to what's going to help somebody too, right? In terms of you hear success stories and they say, oh yeah, this really helped me or that really helped me, can be variable as well, right?
it's very individualized. Some people do really well with just reading. The term book cure was invented by Sarno when he said to me to get these letters from people who read his book in Iowa. They never saw a doctor, never saw a practitioner of any kind. Again, there was nothing online in those days. And they would get better, write him a letter and say, my pain went completely better since I read your book. There's book cures. There's people who need a diagnosis from a practitioner, because they've had other diagnoses that are confusing them. There's people who need therapy. It's very individualized as to what people need. And I think as we get more experience, I'm sure you've found this in your work, we can more closely tailor what a person needs and also be flexible. Sometimes you think somebody needs one thing and then they need something else, and you sort of continue to work with that. You try not to do the same thing over and over again and expect a different result. The old definition of insanity. You try to be flexible. And at the same time, there's core principles, right? I mean, there's core principles that we work on. We probably have some of the same ones. Core principles are you have to really understand the concepts. Another core principle is you have to start increasing your physical activity level. You're a physical therapist and I'm a medical doctor with sports medicine, but Sarno doesn't get enough credit for the fact that he said to people, the example being that wheelchair lady, he said to people, get up and move.
Yeah.
I mean, that was part of his visit. Get up and move. What are you doing?
Yeah.
He'd say that in his seminars. And so he was actually an early advocate for graduated physical activity before anybody had even come up with those terms.
Mm. Yeah,
And
he
so
was ahead of his time. And really, like you said, that's reducing the fear that somebody might have by getting exposure again.
absolutely exposure, build it up. I mean, I tend to be a gradualist. I'm not sure if that's your approach or not, but If
Yeah,
somebody says to me, I
mostly.
can't walk 10 minutes, I say to them, can you walk 4 minutes tomorrow? They go, okay, I'll do 4 minutes. And then I say, okay, add a minute every 2 days. Well, that pretty quickly comes up to 20 minutes.
Yeah,
In a
that's right.
month, if you add a minute every 2 days, it's 15 minutes. And in a month, you're gone from 4 minutes to 20 minutes. So,
Yeah,
and then you're almost up to a half an hour. And so there's lots of ways to do things gradually that work very well. Some people have to jump in the deep end of the pool, but it's not my philosophy in general for most people to do that because I'm afraid that's going to cause potentially a flare up if you're not ready for that. And there's also a lot of people deconditioned, and you and I know that deconditioned people can't go full out right away without getting injured.
yeah, that's right. Yeah, so it's very variable, but the idea of getting back to moving, doing things, and maybe talk a little bit about how it might take some time, or people start going back and they're like, oh, the symptoms just getting worse, and then they want to stop again, and it's TMS. What sort of advice do you give to those people?
Well, I think there's the issue of doubt. We talk about doubt. There was a book that came out this last year by Dan Ratner, Crushing Doubt. I talked about doubt in my book as well. And doubt is, you're struggling with accepting the diagnosis. Sarno always thought that was a key element, accepting the diagnosis of neuroplastic symptoms, TMS. So it could be doubt. It could be fear. It could be that their life circumstances need to change a little bit. Maybe they're just in an awful job or an awful marriage and they need to work on those things, either getting counseling or, getting out of the job sometimes. So, I mean, there's different reasons why people are stuck. And as a practitioner, we support them. And we also try different things. Sometimes I try paradoxical. I talked to someone recently, I gave him a paradoxical approach. Try to think the pain to be as bad as it possibly can over the next 2 days. See what happens.
Yeah, I like that one too.
Right? You like that too? And then
Yeah,
sometimes that ends up like, whoa, I feel better. I'm controlling the pain, right? It's going up when I tell it, it's going down when I tell it. Okay, you got the idea.
yeah,
So you have to sometimes do things that are creative and a little bit different. And the key thing is not to have a time restriction. So people will say to me, "Oh, so what should this program take? Like 2 months?" I read about these cases in Dr. Sarno's books or other books where people got better in 3 weeks. Is that how long I should expect? So I'm very clear to say to people that, especially Sarno's books, which are edited by New York editors trying to make his book more sellable, they tended to include the stories that of the more dramatic
yeah,
recoveries. I was very conscious in my book to try to include people who got better quickly and people who took a lot longer to get better.
yeah,
When you talk to people in this field, there's people who get better very quickly, and there's people who need 3 to 6 months. There's the occasional person who needs longer than that, over a year. But I don't really talk about time. I just say to people, it's on your own timetable. It's not related to your intelligence. It's not related to your effort. Just be somewhat persistent. We may not be consistent because we may try different things over the course of your recovery, but we're going to try to be persistent. And occasionally we'll take breaks. I have people sometimes take a week, don't do anything. Don't
yeah.
journal, don't read, just live your life for a week and then we'll come back to it. Sometimes people need that as well. Have you tried that as well, Jim?
Oh
What you
yeah. Those are
Yeah,
the people that are just trying too hard, or they're just at the
yeah,
end of the line. It's okay. Let's just relax, right? So maybe sometimes, and that will help them. Just they didn't realize how much pressure they're putting on themselves, or going too hard or going too fast, and slowing down was actually an answer for them. Um,
yeah.
yeah,
So we've come to similar conclusions on that. You can overdo it.
yeah, yeah, oh yeah. You see a lot of the same stuff. Well, I want to finish up with just how people could get in touch with you, and obviously you're in Los Angeles. Maybe give people how they can reach out to you if they need some help from you.
Well, you'll find my office phone number on my website, mindbodymedicine.com. There's also a schechtermd.com website for the practice that has forms and things, but usually people call the office or email my secretary to find out what needs to happen to make an appointment. I'm currently able to see people in California for in-person or virtual visits. Typically able to do follow-ups out of state, but initial has to be in person or in California. And I'm on Instagram. I post some stuff. I think
I've
it's
seen some of your stuff. It's great.
Doctor. I think it's Pain underscore MD underscore LA, or maybe that's my Twitter. Instagram is Dr. Dave LA, and do some videos on that. Facebook, I have Facebook.com, Think Away Your Pain. So there's different ways to find me on social media. I think they're also linked on my website. And I don't post as much as Jim, but I post somewhat frequently on things. And Yeah, I mean, I'm mostly able to help you when I do a consultation. I'm not, emails, people write me emails and say, can you this and that? You have to, as a doctor, you have to be cautious, until you've really seen a patient, examine them, review their imaging. It's hard to give really detailed conclusions. But if people ask me for a referral in some state, I'm often able to give that. My website also has lists of practitioners in various states. So you can look at that as well. And yeah, it was great talking to you, Jim. I
Yeah,
always
yeah,
enjoy
and
it.
thank you so much, and I appreciate it. And I think everybody listening, like Dr. Schechter is a great resource, and that's why I wanted to share your info because there's not too many doctors doing this, right? Really, to be honest. So
Unfortunately, not as many as they
not
need
as
to.
many. So Dr. Schechter is an absolute great resource, worked at Sarno, and so that's why I want people to know you're out there if they need you.
We also talked about the potential for Southern California intensive. You could see Jim in San Diego and see me in Los Angeles and get kind of two perspectives and two approaches, and then continue with us potentially virtually.
Yeah, yeah, there's
We also both work internationally as well, so there's different approaches to that.
different
All
approaches.
right,
Yeah. Well, thanks so much for coming on, Dr.
I
Schechter.
enjoyed it.
Appreciate it. Okay, see you later.